Mr. Francis.
How you doing?
Yeah. My name is Wally. I'm going to be your diabetic foot instructor today.
You're welcome.
Okay. My name is Wally Cabo, and I have with me Mr. Francis Koyan. He's here for a TC session on diabetic foot care. Mr. Koyan has been visiting with this hospital for the past couple of days, and he expressed some concern with foot care, even though he's been managing his blood sugar level, but he's been concerned about how can he be able to take care of his foot or his feet. For the purpose of this teaching section, we're going to be concentrating on diabetic foot care, and our goal for this teaching section is to uh, make sure that after this teaching section, Mr. Francis will be able to independently take care of his foot in terms of cleaning, or whenever injury occur to the feet, what can he do about it? And the teaching method we're going to use today will be one-on-one. Like in this section, we'll be doing one-on-one. There'll be times that we'll ask Mr. Francis to demonstrate for us what has been taught, and other times he will be asked to name some items that were discussed in the teaching section. So we're going to begin. And now for our learning objective, we have that Mr. Francis will be able to describe the reason that diabetics are likely to develop foot problems, be able to name the types of foot injury that way, and also be able to describe the type of injury that will require attention, and be able to demonstrate an appropriate wound cleansing, and identify whom he would call in the event of foot injury. Uh, and also he will be able to demonstrate for us proper foot care, demonstrate and verbalize appropriate foot care, and also be able to verbalize understanding of things that are contraindicated in terms of foot care. To begin with, we're going to talk about the pathophysiology of diabetic foot problems. What we really mean is how diabetic foot problems do come about. Diabetes is a chronic health condition that is characterized by high level of blood sugar. So it is meaningful that we be able to control our blood sugar in in the light of this discussion. Diabetic, for those that are diabetics, they are at high risk of developing foot complications, which can otherwise lead to severe conditions such as diabetic neuropathy that we'll be talking about. And it's actually a complication that occurs as a result of untreated or poorly managed diabetes. Diabetes causes nerves in the foot to become damaged, and these damaged nerves make you less able to feel an injury or pressure on your skin of your foot. It also causes damage to the blood vessels, causing less blood and oxygen getting to your feet. This will otherwise prevent the body's ability to fight out infection in the foot, uh, because the foot will be deprived of blood and oxygen. Some of the early symptoms uh, include numbness of the toes and feet, and other symptoms will include the tingling and pain. Uh, it is also important that for in terms of daily foot inspection, it's important that we check our feet daily for any foot conditions or injuries. Uh, you may use one or two ways of doing that. One way it will be by yourself trying to inspect your feet. In the event that you are not able to really look on the soles of your feet, you can use a mirror. In the latter time of, I mean, in the latter part of the discussion, I will show you some visual aid that will identify the kind of mirror that other diabetic patients use. It's customized for that. Or you could also ask somebody to help you look on your feet if you're not able to do so. The foot, the types of foot problems are numerous. It can range from cut, scrapes, corns, calluses, blisters, ingrown toenails, uh, plantar warts, hammer toe, eyelid foot, dry and or cracked skin, you name it. We would be talking about them individually to describe how they come about or what how they are. The types of foot problems that we just talked about, like for cuts and scrapes, uh, this thing may result just from normal daily routine, especially when we are not wearing our shoes. So it's very important that as a diabetic patient, you always keep your shoes on. Corn and calluses may occur as a result the rubbing, continual rubbing together of your skin or something, or a friction that exists between two objects, like your skin rubbing against a rough edge of another object that can cause uh, callus or corn. Blisters are actually the fluid-filled bomb like a bomb. It's filled and it actually come about when we normally wear like tight shoes that do not fit us well, or by wearing shoes without socks. And as a diabetic patient, those are things that you try not to do. Ingrown toenail result when the edges of your toenail grows into the skin. And plantar wart are growth caused by a virus, usually located on the bottom of your feet. Hammer toe is actually the curling of your toe caused by a problem with the middle joint of the toe. Early foot is an infection caused by fungus leading to itchy, red, cracked skin. It may also infect the toenail, causing it to appear thick, sometimes yellow, and become brittle. How do we clean a break in our foot? If you have a skin problem, like a skin tear on your foot or a break in your foot, how do you care about it? And one way to do that is actually the first thing you want to do, you want to make sure you wash your foot with a soap, a mild soap. There are many soap on the market, but some are caustic in nature. You don't want to have a chemical of that sort in your soap, because what it does is it just pull more irritation to the skin, create more irritation to the skin. And we don't also want to use alcohol or something like iodine to put on our foot. Another thing you want to take into consideration is always feel the temperature of the water before putting your feet into the water. You can One way to test whether the water is warm or lukewarm or hot is by testing it. We use our finger to test it, or you could use your elbow to test the water. And once you get through washing your feet, what you want to do, you want to pat dry your feet. Now rub it. Because rubbing your feet to dry it will create another friction, which will create a skin tear. We just want to pat dry it with our towel. Once you've done that, you want to make sure you use lotion, uh, preferably maybe petroleum jelly or linolene oil, something like that. You want to use that and moisturize your feet. One of the reasons for that is you don't want your feet to get uh, increasingly dry, because once it get dry, it may get some cracks in the skin. And as a diabetic patient, you don't want to encourage that. One thing you want to always do when you identify a break, a skin tear on your foot or a breaking in your foot, you want to report such to your doctor, your primary doctor or your healthcare team, and following it in our teaching, we will give you some number that you use to contact us. Uh, the diabetic nurse on the floor here will be able to also help you to take care of that. So once you have anything like blister, bruise, cuts, of any sort or any redness of any sort on your feet, you want to make sure you report that to your doctor. Things that we do for daily foot cleansing, like we said, you want to wash your foot with mild soap and luke water. You want to gently pat dry your feet, especially between your toes. We talk about early foot. One way that that would develop is not drying between your toes, because what happens, fungus will try to, or bacteria will try to grow in there. to create some problem. And we want to make sure we keep our skin to the foot very smooth. Like I said, you want to make sure that you moisturize your feet because you don't want it to be dry. Once it get dry, there'll be crack in the skin, which will create some control area for bacteria, something that you want to rub a very thin coat of lotion over the bottom of your foot on your feet, but not between your toes. Like I said, we want to make sure we keep between our toes dry. Regular foot care. For regular foot care, what we actually do is just the same as we do for when we identify or observe that there's a break in our skin and we're trying to have it, um, we're trying to keep it to be better. The same thing apply with our regular foot care. And this is where you will be all the time, is keeping your foot regularly in shape to avoid you from getting injured. Uh, Number one thing you want to make sure always to keep apply lotion to your dry feet, but not between your toes. Like I said, if you're using powder, you want to make sure you use the powder for sweating, but not powder in the shoes. You can use it directly on your feet for sweating. And this again, apply, use a mild powder. You don't want to use any powder that might have some level of chemical in it that will further irritate the skin of your feet. You want to make sure you uh, soak your feet in warm water before cutting the toenails. And once you cut in your toenail, we want you to cut your toenail straight across to avoid you cutting it very close to the skin, which might cause you to maybe accidentally cut yourself. Another thing we want to take into consideration for calluses and and corns, we want to make sure we use pumice stone to keep the calluses very thin. You don't want to use the method uh, far that on the market because that may accidentally cut you while trying to smooth your callus or your corn. Now, things that we would not want to see happen to our feet or want to make sure that we get, avoid it completely for getting foot problem. These things include commercial remedies for corn or calluses, something like corn removal, whatever that chemical is. We want to make sure we are far from that. You want to contact your healthcare provider to give you advice on what product is good and what is not. The wearing of tight shoes, you don't want to wear tight shoes. You want to wear shoes that fit you, yes, but not tight. You want to make sure that you're wearing uh, non. You should avoid non-cutting socks, non-liner socks. You don't want to wear that or dirty socks. You want to make sure that you don't use heating parts to your feet or hot water. Maybe you say, oh, you're feeling some pain and you're trying to apply some heat there. You don't want to do that because, like we said, when we're talking about how the diabetic foot problem comes about, you'll notice that the nerves, as one of the indicators, will be damaged. And if your nerves damaged, you're not feeding anything in your leg. You use hot water on that, you're not feeding how hot that water is. You may irritate your feet, thereby causing some problem, which we're trying to actually get away from. We want to make sure our feet is in shape. We're taking care of our feet. That's the essence of making sure that our feet is kept intact. And just to give you a brief summary of all that we had discussed, uh, we talk about some of the foot problems that we can identify that are of that are of issue to be reported to our health provider. And those are our cuts, scrapes, corns, calluses, blisters, and we know that some of the reason for some of these problems will be wearing tight shoes, not wearing shoes, maybe using some commercial remedies for corn removers, or probably we using heating pad to maybe cool off some pain that we think we're feeling on our foot, and we don't get to know the temperature of that water once it's applied to our feet because of the nerves breakdown in our feet as a result of the that diabetic process. And we talk about how we can clean our feet. We make sure we use a lukewarm water, a mild soap, petroleum jelly, or a lotion for our feet, avoiding putting them on, between our toes. And once we wash our feet, we want to pat dry it, not by rubbing it with towel to say we dry, get pat dry, because we try to avoid irritating the skin of our foot. And we want to make sure that we once we wash our feet, we dry between our toes. If we are using powder, we want to make sure we use a mild powder. Those are some of the things that we will be doing. And I will want you to like demonstrate like I would do with the washing of the feet, and then you can return that demonstration for me in terms of how we go about cleaning our feet. I have for you also a post test from the discussion we have had. It's just about 5 questions post test, and this is just to tell me what you understood of what we did, and it's just 5 questions. Uh, we can do it together, or you can by doing it together. I mean, if you can go in and fill those spaces, and then we can discuss that. And if you have some question for me or any concern, then we can address that too also. So we probably try to a couple of questions, just about 5 questions we try to ask. The first one say, what are the signs and symptoms of possible diabetic foot? When you have diabetes, what are those signs that will say you having some problem? And then the second one asks, why is it important to take care of your feet? The third is, what are some precautions that should be taken to avoid injury? Then four say lists at least three types of foot problems. Then number five say, how often should you inspect your feet? So we will be, I'll give you at most a couple of minutes, and after you do that, we will discuss that. So number one question is signs symptoms of our feet. All right. So what would be one of the signs symptom of a foot problem?
Some of the symptom would be like on the numbers.
Yeah, some of the symptoms would be like what?
Is
No,
numbness
yeah, numbness.
and by having like some of the symptom like by having like I don't know hammer tools.
We get talking about symptom right now. Uh, you get that right. I mean, that number two question you're trying to answer. Okay, but I mean, you're right. You talk about numbness and the tingling.
Tingling and having soda is very difficult to kill because I
Yeah,
understood a diabetic patient who has so it's very hard to kill.
yeah, because yeah, that's for sure. We talk about that too. We talk about the difficulty of oxygen
Yeah,
being able to go there and blood too. So once the blood is stopped from going down your leg, definitely the ability for the body to fight any
disease.
disease over there will be hard. I mean, your antibody is carried by the blood.
Yeah, almost like I think the cell in there is
Yeah,
there.
yeah, okay, so you got that right. Okay, that's right. Well, I mean, this I get feedback that if you have any question for me, you can ask that question, and then we can. Uh, but I brought. I mean, I get to show you some of the things like this. A powder. This a mild powder. You see that it will say a medicated powder. Some will say that it's mild. It doesn't have like any chemical component in it to irritate your food. And we have like a petroleum jelly, normal like maybe a Vaseline, just a plain baby Vaseline to get moisturize your feet. And these are some of the things. And we have some pictures here too that it's just a floral cards about this will tell you uh, just a reminder as how to wash your feet and various steps that you can take. And the mirror we're talking about that you can use customized for that. It's a handheld mirror. It's you just show that and it you can be able to really see your feet. These are and at the back here we have some telephone numbers here. We have some number here This for the diabetic nurse number, and this the physician. We also have people who comes here to just do lecture on viral disease processing. We have the diabetic person specialist right here. They also come here and sometimes teach people about some aspect of diabetic. And today we only taking the time to talk only about the foot care. So, any question, Professor? You would carry this one with you too, though.
I just wanted you to clarify thing like you said, a diabetic patient, and after taking shower, and I wanted to know why. And you said I think after taking shower, if you wiping yourself, you just I think they
Yeah,
tell
the
you it's
reason why
powdery.
we the stress uh, part dry is because sometimes our skin is that fragile, especially diabetic patient. You don't want to irritate the skin. I think that's the whole essence of the whole thing. It's been, I mean, study has shown that that will help to decrease uh, injury to
Okay,
diabetic foot.
sometimes the towel is too dry or
Yes, the
sweaty.
towel may be too dry, and maybe while trying to do that. So apart drying out your foot will help a very long way too. Like I said, I mean this session is meant for us to teach teach you, and you in turn try to give back as to what you learn
So
in
you
terms of
always
getting.
keep between the toes and dry.
Yeah, you always want to make your after taking bath or washing your feet, you want to make sure between your toes are dry. Um, you don't want that between your toes to be moist. You can have any growth of fungus growth in between your toes, which will cause another problem.
So
Yeah. So you have any question?
yeah,
Like I told you, you have all our numbers there. You welcome to call anytime, and uh, like I said, we have the head of the diabetic program here. The number is in there. We have all the nurses that actually do teaching around the clock. They get scheduled there. You're welcome to come in most of the time. I mean, doing the teaching session, and you can ask any question, and you're welcome to call anytime to ask your question. So it's been nice talking to you, Mr. Francis.
thank you very much for your education. At least I achieved a lot from you from what you just explained tonight,
Okay.
and more especially and talking about the hot water, how to feed the hot
Yeah,
water with
yeah,
the
okay.
tone of the finger or your elbow.
Okay.
Please.
All right. Well, nice talking to you, Mr. Francis.
Thank you very much.
All right.